So let's say somebody is at week 8 and they're on 40 milligrams. They're actually doing great. They got a PHQ score of 4. I'm not sure I have a PHQ score of 4 today. I might have a little higher. Actually, this morning it was probably like a 10. But now I'm about a 3. But let's say their problem was anorgasmia, which is, not so pleasant. A good thing to do would be to switch it to another medication. I'd actually probably just add another medication because I hate to mess with something that's working, if at all possible. So I'd add like mirtazapine or Buspar or even actually bupropion. There's other fancy things that you can do, but since you're not physicians, I'm not going to go into all the details.
Physicians know that? Because I'm feeling like...
Some physicians do, some physicians don't.
Some do, but most primary care doctors
don't
do not feel comfortable.
Yeah, they don't know that. I think most psychiatrists would feel comfortable doing these things, and they do things like prescribe Viagra. I mean, some of them actually prescribe like methylphenidate, like low doses, but I don't recommend any of that. But I'm not, but those are some of the tricks that people do. Partial responders, let's say they have PHQ score 9 of 10 and they're on 40 milligrams, so you just want to increase it or add CBT. That's always an option, doing more therapy. Yes?
I was just curious about how, like you mentioned about, pregnant women, and obviously there's choice of, patient choice involved whether to do CBT and or medication therapy, but do you have other kind of heuristics, rules of thumbs, considerations about when you might want, to switch someone to CBT rather than...
Well, I mean, I think the reality is that CBT doesn't exist for most of the populations that we work with. At least that I actually am lucky because I'm at Harbor, which is a teaching hospital, and they do have CBT. But I know it doesn't exist necessarily in most places. I mean, that's hopefully one of the goals of this study is that we can enhance capacity around.
Would you say ideally it would be great if people got both?
It would be ideal if people got both, and people, the studies seem to suggest that people who get both do best. But with CBT and medication, depending on which study you believe, they work about the same. Maybe CBT works better longer than medication. But yes.
What about acupuncture?
The question was acupuncture. Actually, the studies on acupuncture have been they're hard to assess, meaning that there have been a number of studies on acupuncture. The best studies have actually been with pregnant women in acupuncture, because it's hard to do a study on using a modality if you don't have a condition that is, especially if you have an effective treatment. So the one group that they tried it on was acupuncture, because there's some concerns around, this was a couple years ago, around whether the medications affect development and all that. But they were equivocal because it's hard to come up with what they call a placebo for acupuncture, right? And so it's hard to really test it. So the studies have been very equivocal, meaning that it's unclear what to make of the results.
What about herbals? I know a lot of our patients have come with
St. John's wort, that's a very good question. St. John's wort has been shown to work in some studies and shown not to work in other studies. In general, I think that it probably doesn't work as much as we hoped it would. A couple reasons why. One, because herbal medications, by law, there's no consistency. So what you get from one place, what you get within a bottle, what is called St. John's wort, what they call the bioavailable equivalents of each pill, there is zero consistency in any of those pills, right? In the drug studies, in the herbal supplement studies, they actually, because it's a study, they had equivalency. So even in the best situation, there were a couple studies that were positive, a couple studies that were negative, but it basically showed that it wasn't clear whether it worked. So if it doesn't work in the best situation, it's probably really not going to work in a situation where you're not clear exactly what you're getting. I like to tell my patients when they come up with this question is that there's no bioequivalency. I mean, actually, my background, my family is very much into acupuncture. My mother is, first generation Korean, acupuncturist, herbal medications. So I've grown up with that. I get that, right? But on the other hand, it's like, literally billions of dollars have been spent sometimes developing some of these treatments, and some of them, and they're not perfect, but they generally work fairly well, especially these older ones.